The age of first-time motherhood is rising in North America and Western Europe. In 1970, the average age of a woman having her first child was 21. Today, it's 25. In some European countries, it's even higher at 30. The reasons? More and more women are postponing childbirth as they pursue careers. Women are marrying later, and many women are starting second families following a divorce and remarriage. And while birth rates are generally down across the board, more older women are becoming moms. According to the Centers for Disease Control, the birth rate for women aged 40 to 44 rose 3% in 2009. For those 45 to 49, births also rose 3%. For women above 50, the number of births increased 5%. In 2009, women over 50 had 569 babies. That's an increase of 300% since 1997.
Are you up in the air? Oh, yeah.
Lynn Leszewski is a working mom, busy raising her energetic toddler, Kyle.
I had Kyle when I was 51, mainly because I didn't meet anyone until I was in my 40s, and I really didn't want to raise a son or a child alone.
Having focused on her career, Leszewski finally met her partner, Tim Carey. When the couple decided to have a child, they were told natural conception was not an option. Neither was in vitro fertilization. The solution? An egg donor.
After thinking about it for a couple years, and also after the death of Tim's father, I thought it would be really nice for him to have a genetic baby.
But Leszewski had trouble finding an OB/GYN who would take her on as a patient because of her age.
I was pretty surprised when I got turned down by 2 or 3 clinics until I found one that would take my case.
And when she found a doctor to treat her, Leszewski was given an intense workup.
I did an awful lot of testing before I got pregnant because they wanted to make sure that there would be no troubles with high blood pressure or heart problems.
Leszewski says she had an easy pregnancy.
I never got really, big, so I didn't feel like, oh, I can't even move, or rode my bike to the train station every day and did everything that I usually do. Went to yoga 3 times a week, stood on my head till 2 days before I was delivered.
But she developed a condition that threatened her liver function. So Kyle was delivered early at 37 weeks by C-section.
The complications of pregnancy, regardless of what they are, high blood pressure, diabetes, bleeding, cesarean section, all of those things get magnified as a woman ages.
Later pregnancies may raise not only physical concerns, sometimes there are also sociological issues. Angel La Liberté had her first child at 41 and her second at 44. She felt a disconnect from younger mothers she met.
There weren't a lot of things to talk about at preschool or, in the playground. You can be mistaken for the grandma.
La Liberté decided to become an advocate for women who become mothers later in life after her son made a disturbing comment.
I was cooking away and he said, "Hey, Mommy, do you know what you're going to be when I grow up?" And I said, "Well, no, what am I going to be when you grow up?" And he said, "My grandma."
She launched a website.
It was putting a beacon out there and saying, "Is there anyone else?" And I suddenly started getting emails from everywhere.
But the responses were not all positive.
What I did learn was there was a tremendous amount of social stigma. And I think that society has this stereotype. I think it's getting tougher for the women who are in mid-40s, late 40s, because people have a sense that if a woman is going through menopause, she should not be bearing children.
Sentiment on the street about older women having babies is mixed.
Having a baby in your 50s and then being in your 70s when they're 20, when you're first really enjoying them and they become really, like sort of more like your companion. I think it's hard, and I think women in their 50s doing play dates and running around, and it's a lot of work.
I think that women have the right to welcome a baby in this world. It's very important because maybe she has certain frustrations that she couldn't make it before. But do you know, now we have the longevity, and also we have other type of elements that could help us.
You may be alive at age 70 or 80 or 90, but you have to factor in potential disability. Many of them are disabled, many of them are having difficulty. So You may be alive, but there may be something there that's making it difficult for you to raise your child.
While reproductive technology is giving women more options with childbearing, what are the medical implications? And what is the impact on a society with more older parents?